These 6 countries had no COVID lockdowns. What's been the outcome? 1. Sweden. Sweden didn't implement lockdowns, unlike Denmark, Norway, and Finland. Instead, the government relied on voluntary behavioral changes. Researchers have compared data on excess deaths between the countries. Sweden showed a noticeable mortality spike early on. In the other 3 countries, excess mortality fell in 2020. However, it rose compared to Sweden in 2021 and 2022. The 4 countries have a comparable number of excess deaths per capita. Sweden's economic costs were also much lower. However, it had higher mortality among the elderly in care homes. 2. Tanzania. President John Magufuli dismissed lockdowns and other public health interventions. He advocated for traditional herbs. Magufuli also rejected vaccines when they became available. Hospitals were told not to put COVID as a cause of death. Officially, only around 840 people in Tanzania died of COVID-19. An international group of researchers made a different estimate. They put the total number of deaths in Tanzania during the first 2 years at 102,000 to 188,000. 3. Iceland. Iceland has been compared to New Zealand. Both are wealthy island nations with relatively small populations. But New Zealand introduced a strict lockdown on March 25, 2020. Iceland never did, instead introducing a test and trace program. Infections and contacts between people were monitored. Infected individuals were asked to observe quarantine for a time. Iceland had some restrictions on social gatherings. It also briefly closed its borders to some travelers. Both countries fared about the same in terms of mortality rates. 4. Uruguay. The Uruguayan government enforced some forms of social distancing. Uruguay's borders were also closed to certain travelers, but ports remained open, and there was no stay-at-home order. Excess deaths were low in Uruguay during 2020, but they actually rose substantially in 2021 and 2022. Excess deaths in 2021, for example, were nearly 19% above the expected figure. 5. Japan. Initially, Japan was able to keep COVID-19 deaths to a relatively low level. By the summer of 2022, COVID-19 deaths had reached 36,200. Today, they stand at 130,000. Some researchers have praised Japan's approach. Even without a lockdown, Japan managed to suppress epidemic curves. However, Japanese hospitals quickly ran out of beds. This affected some patients who couldn't be admitted. 6. Taiwan. Taiwan avoided lockdown through drastic measures. It introduced fine-grained monitoring and control of the entire population. This approach was later mimicked by South Korea. Even in Taiwan, however, COVID-19 outbreaks caused problems. In the first half of 2021 and then again in 2022, cases surged. But COVID-19 deaths became less common over time. Taiwan's health authorities made vaccines widely available to the population.